kind of gets woven into their life story. Like, I am a depressed person. That's who I am.
The challenging part about a new parent going to psychotherapy is, especially if they're breastfeeding, what about the baby? Anybody looked at ketamine for postpartum depression? All I'm hearing is that it's this amazing rapid-acting antidepressant. Literature says that antidepressants are safe for breastfeeding moms who have depression. However, I would just like to add that the research is pretty scarce. I'm not throwing shade on that mom or any mom who takes an antidepressant. I think we need to treat the moms who are suffering because that impacts the family. Or because you don't have to take ketamine every day, you could pump and dump for 12 hours, not give your infant any ketamine through the breast milk at all, if you wanted to.
Who we are as well. It's not just this miracle drug. It's actually something within us gets activated.
So from that moment on, I was able to reclaim my original identity as a joyful person. Again, just like the adults that we were seeing had tried so many forms of treatment, inpatient hospitalization, the residential treatment, intensive outpatient programs, all of the medicines, and nothing was working.
We had quite a few moms coming in that had postpartum depression, postpartum psychosis as well. And they were always the most serious case situation because there wasn't as many tools that we could use, and we were so worried about how the mom felt being inpatient away from her newborn.
I'm actually not depressed. I've been depressed in the past, but I'm not depressed, and that depression wasn't even mine.
Hello and welcome to the Healing Mindset Podcast, brought to you by Martha Mind. We are a network of next-generation mental health clinics offering Spravato and ketamine for people with depression. I'm David Draken, a social worker, psychotherapist, and in this episode, I'm actually talking to Melissa Whippo. She's a psychotherapist and social worker based in California, around the Bay Area. She's deeply experienced in Western medicine, worked in hospitals, done some amazing research, but she's also very experienced in more traditional plant medicines, particularly from the Amazon. She's the founder of the Diva Collective, which is a non-profit that focuses on women's health. They have some amazing looking events and they do some research there that is honestly groundbreaking. Melissa in our episode talks about ketamine more than anything else, how ketamine can be used in different ways for different people. So one of the ways that Melissa is talking about is how to help women in particular with ketamine, and especially women that are postpartum, perinatal. And we also talk about adolescents receiving ketamine, how to help them. And that's an area that has not been studied much, which is why Melissa particularly made some research with teams that looked into those two population groups. Another really enjoyable part of our conversation was ceremony, ritual. In a sense, that is called set and setting, but really it's connection, it's safety, it's trust and presence, and how to work with a client so they feel that in the moment. So enjoy this episode of The Healing Mindset. Thanks again for listening. Lovely to see you, Melissa. How are you doing today?
I'm doing really well. Thank you, David. It's lovely to see you too.
What are some of your favorite things about working with patients using ketamine?
Yeah, thanks, David. I love talking about ketamine. I'm really honored to be able to have this tool that we can work with therapeutically. One of my favorite things about it is that it is a really good, for some people, rapid-acting antidepressant, particularly working with the intramuscular route of administration. We can titrate the experience and we work in teams. I really like working with the physician and myself, particularly when there's a good amount of preparation in the psychotherapy leading up to the session. I've seen people have such profound experiences of healing with this medicine when it's handled really carefully and ethically and with good clinical support and with good intake and what's the word? It's our big buzzword. Integration support.
Yeah.
And the integration really starts in the journey. As a clinician and as a provider, I like working with ketamine because it's shorter than working with the other medicines, but we like to do a 3-hour session with people. So people come in, the first hour is spent talking, setting up the session, the work that they're about to do. Then they experience the ketamine. The physician takes their vitals, gives them the medicine. And then they have whatever experience they have, and we're there holding the container, being of support, but allowing the medicine to be that ally. It's like another therapist in the room that's much smarter than the humans. And then afterward, we talk about it as much as the person is able to be with that, and we anchor the goodness that happened. Sometimes what happens is people have these big experiences with the medicine, and it's hard to hold on to. But I find that with ketamine, especially the way that we've been working with it, people are able to remember what happened, and then that stays with them. And the neuroplastic window afterward is really supportive for the therapeutic work and transformation. And by the time people get to ketamine-assisted psychotherapy, they've often tried everything else. And I'm, anecdotally, I can say that now, having seen, thousands of people with this medicine, mostly it's helpful. Mostly it works out. I haven't seen any adverse events with this medicine as a clinician, as a provider, as a practitioner. So that's probably my favorite thing. It's really a safe medicine to work with.
That's great to hear about, because we do hear some stories in the media about like literally the very rare worst things that could possibly happen with
Yeah.
ketamine. But you've just said you've worked with thousands of people and
Yeah.
it's safe. You haven't seen
Yeah.
any bad outcomes. And I guess you could say a lot of that is because the way that you're working with it, in a sense,
Yeah.
the reverence that you're putting with it. But I love that you said you're helping your patients anchor their experiences as well.
Yeah.
Because that speaks to who we are as well. It's not just this miracle drug. It's
Yeah.
actually something within us gets activated, opens up. So having worked with that many people, Melissa, what is it that it opens up inside of people that you've seen? What does it help them to free, to feel, to ask questions and to integrate it back into real life?
Yeah. I feel like ketamine helps people recover or remember, or some people to discover for the first time their own inner healing intelligence, or what IFS calls the capital S self, or what people call that original true nature. We're not born. I mean, Groff talks about we're born in trauma, but we're not born with all this baggage unless it's ancestral or legacy or transmitted. And so we're born with wholeness. And then what happens often tends to distance us from what we know to be true. And ketamine, not only what it does neurologically, which is fascinating, that cells in our brain are able to communicate that don't ordinarily do so when we're in our ordinary mind or our default mode network. The ketamine allows different cells to interact, so it brings fresh ideas. And this thing that maybe we've been running that doesn't serve us, that contributes to the feeling of depression or loneliness or low self-esteem, however it manifests, all of that quiets. And the ketamine really allows people to connect with their innate wisdom, their own North Star, their own capacity. And I've heard people say coming out, wow, or during wow. And whether it's something like I talked to God, or I became one with nature, or I was dancing, or one woman was having a recovered memory of a past self who was a warrior riding a horse across a plain, and she felt so powerful. So those experiences are real. The medicine helps them have that experience. And then afterward, as they're coming out of it with that tenderness, we can really support people to hold on to that. Now you know it's possible. Now you know that's the real you. All this other stuff that you're working with is not the real you. And so it really helps people even have the possibility that things can be different. They don't have to stay stuck where they are.
This is great talking to you. I'm so happy, Melissa. Thank you. Yeah, I was feeling that client you were talking about there, seeing herself or feeling her previous life and that energy. And there's something powerful about seeing ourselves in new light. And that speaks to neuroplasticity as well.
Yeah.
I'd like to just ask you, how do you see yourself? How do you introduce yourself to folks? How would you tell our audience and our viewers who you are at the moment?
I love that question, the way you asked
Mm.
it. Thank you. Yeah, I'm entering baby elderhood. In some medicine traditions, it's believed that the ages of 50 and 52 are the portal into baby elderhood. And I'm really grateful to be alive at a time when we're remembering the importance of our elders and our wisdom keepers. I just turned 50 a month ago, so I'm in the very beginning of baby elderhood, and it feels really good because
Mm.
I feel like I have a lot of experience. I've been a licensed psychotherapist, practicing for over 20 years now. I was at UCSF for 13 and a half years. I worked in a ketamine clinic for 3.5 years. I've taught at trainings. I'm writing books. I started a nonprofit. I feel really hopeful about the work that's here for me to do. And every time I pray with medicine, I pray for clarity and fortitude and how I may work sustainably to continue to be of service as I'm called to be in the world. And I don't mean that in any kind of egoic kind of way or inflated kind of way. It's deeply humbling to be in this phase of my life. My children are getting older. My oldest is looking at colleges and will be leaving the nest. And so we're all in this portal together of transition. And I find praying and ceremony work to be more important than ever. And to fortify the work that I'm doing with clients, with the nonprofit, with the research, with the books, with teaching, and with speaking with people like you. I'm also really grateful to be at this place in my career and in my life where it feels like a lot of things are starting to make sense that didn't necessarily make sense when I was younger. So I hear my elders talking about the clarity that comes with getting older, and I'm starting to understand that, just like a micro amount. So I'm really grateful to be here now and to be here today with you talking about all my favorite things to talk about.
Beautiful. Happy birthday, Melissa. And you
Thank
mentioned that you're, after this podcast, going to a Japanese tea ceremony for your birthday present. So that's
you.
beautiful.
Mhm.
And I want to just talk about ceremony and ritual, actually. It's
Mhm.
been spoken about that it's something we deeply miss in our society, that we used to have kind of rites of passage, initiation, but also just
Yes.
more ceremony, more ritual, more traditions that
Yes.
have been passed down through the generations. And it's also
Mhm.
been spoken that something that psychedelic assisted therapy has as one of its aspects that uh, helps a patient to kind of open up with their body and
Yeah.
mind and maybe their soul is the ritual and ceremony. And I'm not talking
Yeah.
about an ayahuasca circle, although that
Mhm.
obviously is. I'm talking actually being in a clinic and going through an
Mhm.
assessment and screening,
Yeah.
going through that, getting to know people, moving into that chair, having your vitals taken, talking
Mhm.
about what are your intentions, what are your goals, who's in your
Yeah.
support network,
Yeah.
what's the integration plan afterwards. So all of that is
Mhm.
really talking about self, home, family, community, support, resources. It's talking about like truth, like who are you really? Why are you here? And
Yeah.
how can we show up to hold you and support you? So for
Yeah.
me, that's something that a lot of people forget about, that this is actual ritual and ceremony that we are incorporating into, high-tech, scientific, psychedelic therapy. So
Yeah.
what are your experiences around how ritual and ceremony shows up in a
Mhm.
ketamine clinic or doing clinical ketamine work with patients?
Mhm. That's a great question, and I appreciate what you said. Yeah, we do a lot of things that are ceremonial in the office, from the things that are on the walls to offering people tea to inviting people to bring objects with them that might be supportive or important, and photos. I really encourage people to bring photos of their ancestors, of themselves when they were young, of their children if they have children. Um, it's always a conversation because I never, as a clinician, I never want to impose my beliefs or my expectations for ritual and ceremony on anyone. So it's a conversation that happens early on, actually. we ask people about their practices. What kind of daily practices do you engage in that are going to support your integration of this work? Because it is transformative, transformational work. So sometimes in the assessment, I might even recommend that somebody not go through with this kind of treatment at this point unless they have adequate support from their family, from their community. So it's not all on the container, the therapeutic container. The therapeutic container can hold a lot. And if someone's in an abusive situation at home and they're coming into treatment, we want to help them sort that out first so that they're safe at home. Because if someone's going back into an environment that's unsafe, the medicine work is kind of lost. It's not supported. But we do light candles and we burn things in the office with people's permission. We have things up on the walls that are reminiscent of our own plant medicine experiences. And we really invite people to do breath work, to do meditation, to go inward, to call upon their guides. And we talk about it after. I've had people come into the work who specifically would like to meet their guides or who have asked for my support and help with that. That's not something I learned in social work training, but it's something that I've learned along the way, and to be a good listener for the sacred. One of my dear friends and teachers talks about how people are so hungry for the holy and hungry for the sacred and looking. And it's all, we have it all inside, to your point of what we were talking about earlier. But it's really helpful sometimes for people to have objects or photos or things that help them along the way. And it's a really beautiful way to work clinically. And it's really possible that in an office where a physician is taking your vitals and you're about to get an injection in your arm, it can feel very sacred. And that is important and supportive.
Amazing. Yeah, I think helping a person to find that sacred part of them, that holiness, is part of the healing. I think because much of what we have lost and what we miss, that pathology gets pathologized as, is something really sacred. And I want to now move into the direction of depression, something I know very well in my life, and also the particular role of ketamine to treat people that are experiencing depression. And ketamine is a wonderful molecule. It has different routes of administration, different dosages, it had different experiences, but it can also be used to treat different conditions. So it's used for addiction, it's used for trauma, but more than anything, it's used for depression.
Yeah.
So what, in your experience, Melissa, would explain why it is that ketamine is so effective for people with depression? You've mentioned neuroplasticity already, but that and what other things do you feel like it really matches well with someone who is depressed and comes in looking for a way through that depression?
Yeah. And I can share a little bit about my own experience with it as well. I suffered from depression when I was younger, in my early 20s, and I went to a psychoanalytic treatment, which was very helpful. And then years later, when I experienced intramuscular ketamine for the first time, I certainly have a bias about that route of administration. And it was in a training. It was when I was doing my ketamine-assisted psychotherapy training. I'd never experienced ketamine previously. And so two things that I noticed and experienced was that ketamine could be very synergistic with the other medicine work. I had recently come back from my first ayahuasca experience in Peru, and the first time I took the medicine in the training, it was the oral lozenges, the rapid dissolve tablets, and I was immediately transported back to the jungle. And I was delighted. It was so beautiful. And I was like, oh, wow. And then I noticed that consistently for people and also for myself, that ketamine could really pick up the signature of other medicine work, and that people could invite mushrooms or MDMA experiences into their ketamine experience as a way to continue the thread or the healing or whatever was happening. With the intramuscular route of administration, I was immediately transported to my own birth experience, which was traumatic, and I was a forceps baby. But I had this realization that happened in the ketamine space of, oh, I just took on my mother's depression. It's actually not mine. The experiences that I've had with depression in my life is something that I was working through that actually belonged to her. And when I talked to Dick Schwartz about this, when he and I were teaching in a training together, he said, oh, that was a spontaneous unburdening of a legacy burden of some, we call it vicarious trauma, we call it legacy burden, where people have inadvertently taken on something that didn't belong to them intrinsically. And so from that moment on, I was able to reclaim my original identity as a joyful person. And that was what I heard in the ketamine space. Oh, I'm actually not depressed. I've been depressed in the past, but I'm not depressed. And that depression wasn't even mine. And it was like, it felt so good, David, this spontaneous unburdening. And that's what I see being, the really beautiful aspect of ketamine helping people with depression. It's not a panacea. It's not a magic medicine. The work is still really important. But what I see is that people are able to have a different view of themselves with the support of that medicine. And that is what allows the breakthrough into the depression, because often depression is about looping thoughts, whether they're, negative self-talk, obsessional thoughts, outdated belief systems. And because ketamine can quiet that looping thinking pattern, get us outside of our ordinary mind or the default mode network, we're able to have a different view of ourselves, a different experience. And then we come out of the medicine, but that reality of what we experienced stays. And in the therapy, we can build on that. And that's what I see as being so helpful for people, particularly with treatment-resistant depression, who've tried every antidepressant, every medication, every mood stabilizer, therapy for years and years and years, and they come to ketamine and they have this, potentially spontaneous unburdening opportunity where they can see themselves differently. And that makes a huge difference.
Yeah, I love that. Thanks a lot, Melissa. I've had experiences myself with my depression where I've seen myself separating from my depression, whereas prior to that, I was the depression. So I've actually changed how I talk about my depression when I am depressed. So instead of saying I am depressed, I am feeling depressed. And because when I am feeling depressed, I identify with that depression. Like it becomes my reality. And having worked with clients, especially with treatment-resistant depression, it kind of gets woven into their life story. Like I am a depressed person. That's who I am. If it's been years and if they've tried everything, then that depression is actually, it's the fabric of their being. It's almost like I'm never going to get rid of this. And that's why it can lead some people to suicide, which is why, ketamine and Spravato is, indicated and on label for major depressive disorder with suicidal ideation and behavior, because it has that rapid acting ability just to drop those kind of ruminating thoughts. So there's something really powerful around our identity, just to see ourselves differently. That's a little bit liberating. So maybe we could even still be depressed, but it means that who I actually am isn't who I used to think I was as a depressed person.
Right. Exactly.
All right. So I've got some more questions around the topics that you've done research on, Melissa. So there's a few things that you've worked on in the past that are a little bit taboo, that not that many people kind of talk about it, write about it, research about it. For whatever reasons, you can definitely share your thoughts. And that's using ketamine with adolescents and using ketamine with moms who are lactating and breastfeeding. And why do you think, just as a first question, why did you want to choose these two topics, amongst others that you specialize in, as ones that needed to be researched?
Well, when I was at UCSF, I was in the obstetrics clinic for 10 years. So I was seeing so many people come through who had really deep struggles with their mood during their pregnancy and in the postpartum setting. their treatment options in the postpartum setting were antidepressants or other pharmaceuticals, which may or may not impact the breastfeeding, or psychotherapy, which, as you know, as a parent yourself, the challenging part about a new parent going to psychotherapy is, especially if they're breastfeeding, what about the baby? And so part of my job was to help people access treatment. And when I started in the OB clinic in 2010, January 2010. And when I did my ketamine-assisted psychotherapy training in 2018, I was pretty burned out. But I sat there listening. I didn't know anything about ketamine. So I'm completely in beginner's mind, new mind, and everything is lighting up for me. And I raised my hand. I said, has anybody looked at ketamine for postpartum depression? All I'm hearing is that it's this amazing rapid-acting antidepressant. To me, there was nothing taboo about it. It just came through in a very innocent way. And when we looked at the literature, nobody had looked at the way that ketamine interacted with breast milk. So that was the first thing. So we did a study that we started December of 2019. And then you know what happened after that? The pandemic started. Well, it didn't start. It was very much, we were paying attention to it, all of us in healthcare. We were, in December of 2019, we were very much paying attention to it. And then so the study took a little bit longer, but we were able to work with volunteers who very generously pumped breast milk, and we were able to lab test, actually at the lab at UCSF, and the lab manager at the time was also a mother. She gave her breast milk as a control against the ketamine breast milk. We had them do a 0 pump before they received medicine, then they pumped in 3-hour increments. And because ketamine, particularly with the intramuscular route of administration, has a half-life of about 12 hours, the breast milk had 0 ketamine in it after 12 hours. And at each of the 3-hour marks had minimal, what scientists would call negligent amounts, subclinical amounts, nanograms. And the literature says that antidepressants are safe for breastfeeding moms who have depression. However, I would just like to add that the research is pretty scarce, and it doesn't include any longitudinal studies. We don't know what a 12-year-old looks like whose mother breastfed them while they were taking an SSRI. I'm not throwing shade on that mom or any mom who takes an antidepressant. I think we need to treat the moms who are suffering because that impacts the family. But ketamine is the first-line anesthetic in pediatric emergency rooms. So I'm also not a medical provider. I'm not a physician. I don't give medical advice. And everyone has to do their own risk versus benefit analysis. And we actually have data that says at the intramuscular route of administration, less ketamine passes through the breast milk than an SSRI. Or, because you don't have to take ketamine every day, you could pump and dump for 12 hours and not give your infant any ketamine through the breast milk at all if you wanted to. But to me, it felt like, wow, what if we could offer postpartum breastfeeding people a different option for treatment that didn't make them have to stop breastfeeding, and it's not something that they have to take every day.
Yeah.
So to me, it felt like it made sense. So that paper came out a few years ago in the Journal of Psychoactive Drugs.
Yeah.
And then should I pause before I talk about the adolescents?
Oh, I just wanted to, that was really great to hear about. And I love that you did that research because there was a gap there. I just wanted to share, I was working at Mount Sinai Hospital in Upper East Side of Manhattan for 3-4 years in the inpatient psych unit. And we had, a lot of really acutely unwell people coming in, and we had quite a few moms coming in that had postpartum depression, postpartum psychosis as well. And they were always the most serious cases. Like they're the ones we took we took everybody seriously, but that one was such a complex situation because there wasn't as many tools that we could use, and we were so worried about how the mom felt being impatient away from her newborn.
Yeah.
Particularly if they're breastfeeding, but even if not, it's still like they're in a psych unit for often a couple of weeks, getting better. So if ketamine could be available, honestly, that would have been a game changer to have had that in this
Right?
inpatient unit to help those mums get discharged sooner, to get
Mm.
home sooner, to their baby sooner. Because the longer that they were away, the worse they were getting. So honestly, that would have been a game changer. I had to share that. And
Thank
I
you.
wanted to, yeah. So the other study you did was with adolescents, and just as an introduction to that one, Melissa, I just posted on LinkedIn. Owen Muir in New York. I'm not sure if you know him at Radial, and he works with Brain Sway as well. Real expert in TMS. He was just sharing that TMS is now being approved to work with adolescents
Great.
for depression, and that's great. I think I shared in my post. I had really acute mental health struggles as a kid, so I'll tell you about them another time. But it was hard going, and gosh, I wish I had a therapist, but probably there's other treatments that would have helped me as well.
Yeah.
And we've got a huge lack of therapists right now and psychiatrists, massive waiting lists.
We-
And to hear that TMS can actually help adolescents, that are struggling with depression and trauma and suicidality, that's brilliant. So just saying that this is a really important topic. What again motivated you to research adolescents and ketamine, and what kind of issues were the adolescents going through that you wanted to study?
Yeah. First of all, I'm sorry that you suffered as a teenager. And, having two teenagers myself, having been a teenager myself, I get it. And I hear a lot about it. And it's something I've talked to a lot of parents about and sent them that paper because I was working in a ketamine clinic at the time. And it just so happened that these families would come to us desperate, again, because their teenager had attempted suicide multiple times. Again, just like the adults that we were seeing had tried so many forms of treatment, inpatient hospitalization, the residential treatment, intensive outpatient programs, all of the medicines, and nothing was working. And so in our clinic, we were seeing a number of teens. And so we decided to write up what we were seeing as a case study because it felt important. And also just to give other clinicians that are also seeing this in other areas kind of a template for what we were seeing that was working. And so really when we're working with teenagers, we're working with the whole family system. And often the teenager who is acting out becomes the IP or the identified patient. And so bringing the parents in and sometimes the siblings, depending on the situation, for family sessions was very useful just to also support the teenager in not feeling like they were the identified patient or the problem in the family system, that it was a bigger problem that was happening in the family as a result of, never blaming anybody, but really inviting everybody to take a look at the whole system. And, you and I are both social workers. That's a big part of our training as person inside of their system. And what are they exposed to? What are they living with? What's their environment? And so the one teenager that I was working with specifically at that time came in after many, many suicide attempts. And I'm happy to say that after a year of working with us, had 0 episodes of self-harm. And we worked really slowly. We started with the oral rapid dissolve tablets. And, teenagers have their ideas about things. I remember this teenager did not want to put an eye mask on and wanted to move around a lot during the session and then vomited and then decided, okay, maybe I'll be still and put the eye mask on. Because we said, he told us that we were, because we worked dyadically, physician and therapist, and the teenager told us that we were like, he called us psychedelic mom and dad, and was able to have these really healing experiences with us, allowing him to have his process and his experience. He became a fish in his first ketamine session. So he was flopping around like a fish. And then, he got pretty nauseated and vomited. And so decided afterward to lie down and use the eye mask. But the fish experience seemed really important because he was playful. It was like he was able to recover his innocence that had been
Mm.
lost in his depression that he was experiencing in adolescence. And it was remarkable, actually, that work. It really reminded me the power of working with the whole family system. And the mother wanted to experience ketamine because she wanted to know what it was like. That was really helpful for her. Even though she wasn't depressed, she was a member in this family system that had this dynamic happening. And she was able to get benefit of seeing things differently. And that really impacted the psychotherapy in a good way. I hear from a lot of parents who have teenagers and they are struggling. I've spoken with other physicians who are starting to open up their practices to include working with ketamine with teenagers. It's, we have to be really careful and safe, but that's how I like to practice with this medicine anyway. So bringing in the whole family system is a really beautiful way to work with this medicine with adolescents. And also just anecdotally seeing so often the rapid acting antidepressant effect being really helpful for this age group. So, yeah.
That's great. I've also noticed that, Melissa. I've seen
Mhm.
more psychiatrists and therapists
Mhm.
working with adolescents with ketamine, because
Yeah.
when you weigh up the pros and cons,
Uh-huh.
it's, I'd say, the ethical thing to do, and it would be
Yes,
unethical not to, particularly
exactly.
because of all the safety data that we have now around ketamine and the
Yes.
protocols, and particularly if we're working, with a family and doing the whole risk mitigation piece.
Yes.
It's we have a need to do that, especially when you think about, and this was in your paper as well that I read, when you think about it, the early intervention piece. If we can work with a young person
Yeah.
when they're in their time of crisis,
Yes.
help them get to the source of it, understand it, process it, move through it, see it differently, bring the family together there and then,
Exactly.
rather
Yeah.
than let it go on and on and on for years. And then when they get to their 20s, 30s, 40s, then it comes out in all kinds of
Yeah.
terrible ways, usually with
Yeah.
addiction or self-harm or something
Right.
else. So,
Yeah.
yeah, any other thoughts around that before we move on?
Yeah, a lot of people's concern is that, okay, if we're giving a teenager drugs, if we're giving them ketamine, it's going to be some kind of a gateway drug. But I've seen actually the opposite happen. We're actually
Mm.
offering a teenager, and I like David, you used the word reverence earlier. We're offering a teenager an experience with medicine that is powerful and transformational, that's in a set and setting that is reverent. And so, what I've noticed with teenagers, it doesn't make them actually want to go out and experiment with other drugs. They actually are developing a relationship with medicine that has reciprocity, support, and reverence built in. So, that's actually setting them up to not just blithely go out and try drugs. We talk a lot about harm reduction as part of the treatment. And so, I actually would say that it's beneficial because the teenagers are so inclined to self-medicate when they're suffering. Having this experience with ketamine sets them up in a different way to have reverence for medicine and to not, they're working with it in a good way. So they're not needing to go out and search for something else.
Yeah, that's a really good point. And part of what I'm taking from that, Melissa, is around the, the experience of being really cared for and held
Yeah.
is reparative and
Yes, it
restorative,
is. Mhm.
of like everyone's there for you, like all the
Yeah.
tension's on you, and it's
Mhm.
fully accepting unconditionally. And
Mhm.
we're here just to be a part of your process and take your time and go inwards and feel what's there, whatever it is. We're here for you.
Yeah.
Just to hear those words or to feel that experientially, oh,
Mhm.
that would be beautiful for a young teenager that's going through a really hard time to feel that.
Right?
Yeah.
Yeah.
All right. So just got a few minutes left, but I really want to hear about the Deva or Diva Collective.
Yeah, you had it right, Deva.
Diva Collective, talking
Yeah.
about particularly being held and creating these
Mm.
containers for ritual and ceremony to go deep within, and thinking of family as well. What is the Deva Collective, and what do you do there, and what's coming down the pipeline?
Yeah, thank you for asking. Deva is a Sanskrit word. It means
Mm.
shining one or the divine. And Pablo Amaringo was an ayahuasquero
Mm.
and an artist in the Amazon in Peru. And he talked about devas being the animating spirits of nature. So there's a deva of the spirit of water, of fire, of earth and air, and that without devas, things are more stagnant. And so it really has this element of movement. So it came to me when I was really supported and invited and encouraged to start this organization, because there's such a gap in research in women's health, in particular with psychedelics. And it's not, as you know, and as I know, and as a lot of people with experience know, it's not one size fits all when it comes to dosing and route of administration for female bodies and male bodies. We have different needs. And so Diva Collective was really founded to address these gaps in the research, and we're focusing on women's health and psychedelics research, education, but also building community, because that's so important for all of us right now going through collective change and healing and all the things that are happening in the world. We need each other more than ever. And there's nothing I love more than supporting other women in this work. And we keep finding each other. It's so exciting. So if you look on our website, you'll see a lot of other practitioners who are involved in various ways, whether it's in the research or we just want to highlight and support their work. There's going to be a lot more of that coming, and also some educational work around psychedelic-assisted psychotherapy for postpartum women. Our first study that we have review board approval for is an observational retrospective study about people in perimenopause who microdose Wachuma or San Pedro. And the active ingredient is mescaline, which here in the United States is a Schedule I medicine, which is why it took us 2 years back and forth with the review board. But our survey is going to go out this week. We'll have a link on our website. We're really excited about that. So it's really just looking at people in perimenopause who've been microdosing this medicine. What are they noticing? What are their practices? How are they doing it? And what I learned when I was doing the literature review for the research proposal for this study is that mescaline actually has a lot of anti-inflammatory properties. And so I didn't know that when we decided what this study would be about. And it's just a way that it feels like the plants and the medicine kind of work through us and bring us information even when our human minds are a little slow to catch up or pick it up. And our next study is going to be an efficacy study looking at ketamine-assisted psychotherapy for postpartum depression. So we're already talking about that with other researchers. The team happens to be all female at this time, but we're very inclusive. We're happy to have all genders supporting our work.
That's really amazing that you're a community and you do lots of fun stuff. And I've seen pictures online, and you're doing clinical IRB approved research. I don't know if I've heard of anyone doing that. That's really, and it's very practical. It's not some theoretical thing. It's not to get a drug approved by the FDA. This is to help women going through perimenopause. That's beautiful.
Thank you.
Yeah.
Yeah, I really see our work, trying to pay homage to all of the original medicine keepers and wisdom keepers, indigenous people working with these sacred medicines, and to be a bridge. And Pam Kriskow has been a mentor to me, and we have talked a lot about making these observational studies more relevant, because really paying attention to the way that people are already working with medicine is a way to really honor the lineage traditions and where these medicines come from. None of the original people working with San Pedro were learning from a book or from an institution. It was a deep spiritual and cosmic practice. So I do feel that, by paying attention to what people are doing in real time, it's a way to be a bridge to some of those practices. And then people who want to do the FDA study can use our paper as a point of reference or as a point of justification. Well, this is why we wanted to do this study, because there is this one paper out there, and hopefully there will be more.
Wonderful. Can't wait. Thanks, Melissa. Last question, I promise.
Okay.
I hear you're writing a book, so I'd love to hear what that book is about and what's it called, when's it coming out?
Thank you for asking. There's a couple of books in the works, but this
Okay.
one that I'm excited about and I'm sharing about is called Beyond the Birth Matrices. So really honoring and picking up where Stan Groff's perinatal birth matrices ends to include and incorporate the experience of the mother, the pregnancy, what she's bringing in, even the difficult bits, the vicarious trauma, the dark things, the full expansion of her experience into that milieu, and talking about reparenting with psychedelics, things that I've seen from my own personal work. I've been to the Amazon a few times now working with plants, and how all of this work actually can support all of us collectively. When we're talking about the feminine or the divine feminine, the masculine is very much included in that. And so it's really an exploration of psychedelic healing with mothers, but it's so much more than that. We all have a mother, we were all born. And so it's for clinicians, but it's also for anyone who's interested in consciousness expanding work and maybe their own attachment work or their own healing work with what if there is birth trauma that feels unresolved, or a lot of things that I've seen clinically, but also some theory and practice woven in as well. It's been really fun. I am working with a publisher. We're not all the way, so I won't say much more about that. But I'm hopeful that it could even come out within a year. Yeah.
Amazing. Yeah, that would be great because, Stan Groff's model, the perinatal birth matrices, is used a lot amongst the psychedelic professionals. And it has quite a few different interpretations and meanings and relevances, but it's not complete, and it was done quite a while ago. And some people find it quite hard to grasp as well. So any new attempts as well, just to refashion it, that sounds great.
Thank
All
you.
right. So, Melissa, before you go, people that want to find out more about you, where should they go for your work and the work of the Diva Collective?
Yeah, thank you. We have a website. It's davacollective.org. We used to have fiscal sponsorship with MAPS. We just ended that cycle. It's been a great couple of years, but now we're a standalone nonprofit organization. You can find out about us there. My personal website really needs a redo, but if you really want to, it's just melissawhippo.com. But you can contact me through either website, and I'd be really happy to connect and talk more about all of these things. Thank you so much for having me, David. It's such an honor and a pleasure.
I've loved it. I have to say that you just said something that wasn't true about your website. I think it's awesome. It's got and it's got some really good meditations on it. I just listened to a couple. Yeah, so great stuff. And we didn't get to talk much about meditation and
Or
yoga, but I think
yoga.
it's woven into your work. So yeah, Melissa Whippo, thank you so much for being on the Healing Mindset. It's been just a real pleasure. And thanks for all your work you're doing for so many people that really deserve proper healing.
Thank you, David. I appreciate you a lot.
All right. Thanks for listening and watching, everyone.